Hey guys, Dr. Dominic Sportelli here, board certified psychiatrist, both adult and child and adolescent psychiatrist, and associate program director of Prime Healthcare Psychiatry Residency. I have a big one for you today. So this just came out. The British Journal of Psychiatry showed that long-term antidepressant use may have adverse health outcomes. For quite a long time, we've been prescribing antidepressants pretty regularly. As a matter of fact, some data that I have here is in England, over 70 million antidepressants were prescribed in 2018. This is a 2-time increase over the previous decade, so a lot of antidepressants are being prescribed. I am a medical doctor, I'm a board certified psychiatrist. I do prescribe antidepressants. So this is part of my clinical practice as well, and this is why this is incredibly important to educate everyone out there on this important data. So little's been known about antidepressants and their bad outcomes, even though they've been prescribed for a very, very long time. The newer antidepressants have been around about since the 1980s, but the tricyclics and some of the atypicals have been around much longer than that. I think they're very readily prescribed, obviously by those numbers. 70 million antidepressants were prescribed in 2018, which is a twofold over the previous 10 years. This study specifically was the British Journal of Psychiatry. It was just published. The Bristol Center for Academic Mental Health followed people from 5 to 10 years that were on antidepressants. And they categorized the antidepressants as well. So they looked at the typical antidepressants, which are the SSRIs. You may have heard of some of these like paroxetine or fluoxetine, or even citalopram. These are some of the more common ones. But they also looked at some of the other antidepressants in the SSNRI class, like duloxetine, venlafaxine, and some of the atypicals like trazodone or mirtazapine. They followed over 200,000 individuals looking at data out of a service called the UK Biobank. So they're able to follow these people, and what they tried to do was take into account pre-existing conditions like cardiovascular disease and whatnot to try and reduce as much bias as possible when looking at this data. And what they did find was that when people do take antidepressants over the course of at least 5 to 10 years, they did have a higher incidence of cardiovascular events such as hypertension, cardiovascular disease, potential stroke, and diabetes. Other thing that they noticed actually are the people that were taking other antidepressants that were usually used for more severely clinical depression, such as mirtazapine, venlafaxine, duloxetine, and trazodone, which are the SSNRIs and the atypical antidepressants, even had a higher incidence of some of these issues as well. This study is important, right? We need to follow people that are taking medicine to see what potential bad outcomes there are. And we need to really, really pay attention to this because, in my opinion, there is no such thing as a medicine without side effects. I don't care what it is. So we really have to pay attention to this. And they're not benign medicines, guys. So, these medicines do have potential for problems. The issue with this study is that it was very hard for the researchers and the authors to sort of hash out someone with a severe mood disorder, like a severe depression, and its link to cardiovascular disease, hypertension, which is high blood pressure, insulin issues, maybe diabetes, and maybe even stroke. There is a correlation between mood disorders themselves and those issues as well. And the fact that the people that had more severe depression, the people that were placed on some of those more atypical or quote unquote stronger or second line antidepressants tended to have worse physical outcomes as well. It's really, really hard to hash that out whether or not it was the actual antidepressant that was causing it or the terrible depression and mood disorder. So further studies have to be undertaken for sure, but this is definitely a good start to pay attention to these things. I think there's a very, very important message with this is that long-term antidepressant use may not be harm-free, right? So we have to pay attention to that as doctors, as prescribers, as neuroscientists and behavioral health specialists. And also, I think this is for people to have more informed conversations with their psychiatrists or their primary healthcare doctors about these medicines and what they may be experiencing. And I think number 3 is to make sure that if you are on these medicines, please have your doctors pay attention to your cardiovascular health, your pulmonary health, your cardiovascular health, and your metabolic health, your blood sugar and things of that nature. This is really important data, guys. And being a prescriber myself and a medical doctor as my primary foundation of education and a psychiatrist board certified, We do use these medicines, and I don't take these medicines lightly at all. I always recommend psychotherapeutic intervention for my patients, the combination of psychotherapy and medicines, or maybe just really good psychotherapy if the patient is amenable to it. So they're not without risk. Make sure you talk to your doctor about these things, and this is really good data to work on moving forward. Hopefully you guys enjoy these little research updates in behavioral health, and look forward to getting some more information out there for you soon. If you find this content helpful, definitely follow me, and we'll keep you updated.